name is Sandra Samuels, host of Boss Lady Live, where I come to you every Monday night with experts to discuss issues of crime and violence, love and relationships, health and wellness, various different topics that affect us right here in Jamaica. Please like and share and subscribe. Click on the notification bell to be advised when you're on. See you then.
Good evening, good evening, good evening. Welcome again to Boss Lady Live. This, like every other Monday night, we bring information to you that is relevant, that is important, that is probably life-saving. This evening, we are going to speak on lupus. Now, I'm sure many of us have heard about it. Last week, we had the very vivacious Marsha Ann Brown speaking on her experience with lupus. This week, I wanted her from last week, but she's very busy. Very, very, very busy. Dr. Desiree Toller-Reed. She's a rheumatologist. And we have also joining us Georgia Johnson. She's a survivor, thriver, warrior. She will let us know in just a minute about herself. Welcome, ladies.
Thank you.
Thank you. Thank you for having us.
You are welcome. So let me tell you a little bit, just a few lines on Dr. Desiree Toller-Reed. She is a consultant rheumatologist specializing in the care of persons with lupus. Now, I didn't know this. This was news to me because I was searching for who takes care of patients with lupus and stuff and so forth and so on. And when I asked around, your name came up. Because I came to you, I met you because I was trying to find out if I had arthritis or not. So I thought rheumatologists just dealt with like arthritis and things of the bone. Never knew that you also dealt with lupus. So she also serves as president of the Lupus Foundation of Jamaica, with which she has been volunteering since 2009. And she's going to tell us a little bit about that as well. So, Doc, thank you so much for joining us. I know you're very, very, very busy. You were working up to almost 7 o'clock. So I am deeply appreciative of your time and your efforts. So let us start with just, in a nutshell, what is lupus?
Well, that is actually a good question because that's a question on the minds of many people. And in a nutshell, lupus is a disorder of the immune system. It affects many Jamaicans. I like to say up front that it's not cancer and it's not contagious.
Right.
It's what we call an autoimmune disorder or an autoimmune disease. So that term, autoimmune, actually describes a whole family or a group of conditions that could occur when the immune system that should defend us instead turns against us by mistake and starts attacking healthy organs and tissues. So there are many, many different autoimmune conditions, actually. And lupus is just one, but it's considered one of the most serious or potentially serious, because almost any organ or tissue can become involved. So when the immune system turns against you or against the particular tissue, it causes inflammation and it can cause damage to that area that is affected. So
is there any particular thing that brings on lupus? Is it genetic? Is it caused by something that we may have been exposed to? What causes lupus? Do we know?
So there's no one simple answer to that question. It seems to be that there's no one cause for lupus. It may be a sort of perfect storm a coming together of a number of what we call risk factors that actually just come together at a particular time and allow the dysfunction in the immune system to occur. So it may include genetic factors, hormonal factors, factors in the environment, even something as innocuous or ubiquitous as the sun exposure, or infections that all of us get all the time. So these could potentially be triggers in a person who is predisposed in some way, usually for genetic reasons. They may have a predisposition. Their immune system may be a little bit more sensitive, and maybe over time exposed to different things, it may become dysfunctional. Okay, and the immune system loses its ability to distinguish properly between what it should attack and what it should leave alone. So that's basically what happens, and sooner or later, and it may be possibly years from the time the immune system becomes dysfunctional. Sometimes it actually may take a while before it presents itself with symptoms.
Right.
So we don't know any one thing. Sometimes people can point to something that happened. I was pregnant and then, or I got an infection, I got dengue and then, or I went to the beach one day, got a sunburn and then, so there could be a lot of things that people may. I got married. So there are a lot of things that got a wedding. So there may be a lot of things that people may identify as triggers for the symptoms to appear, but quite likely there was this setup that was probably present and going on before.
And speaking of symptoms, what are some of the symptoms that could say to you that you may be experiencing lupus?
You ask great questions because lupus is sometimes called the disease of many faces. That's an expression that we sometimes use for it in medicine. And that is just to remind us to always think of it if somebody presents with a whole range of symptoms. And it can vary from person to person. So the symptom will depend on which organ or part of the body is affected. So this could be from the skin, the joints, blood cells, and even internal organs such as kidney, heart, lung, and brain. So, any of these could be involved. And so you can imagine the person may present with something like, for instance, fever. Just fever that won't go away or keeps coming back. Weakness, fatigue, you can't quite explain it. And then they may present with unusual rashes. Sometimes rashes in areas that get exposed to the sun. That's a classic or famous way for lupus to present. There's also this rash that may appear on the front of your face that we call a butterfly rash because of how it appears on the cheeks. And that is also supposed to be one of these characteristic. But not everybody has rashes. You also have rashes that can scar, like rashes that go really deep and can leave you with scars. Some people may experience hair falling out, and that's another skin manifestation where it may fall out in clumps or it just may fall out all over. Joint pain is a common one. So you wanted to know why rheumatologists end up treating lupus.
Right.
Because, yes, joint pain, many conditions cause joint pain, and lupus is one of them. And then, for instance, a lot of people have kidney involvement, and sometimes how they may know is the legs may be swollen. And that's because you have fluid retention because the kidney is involved. Things like inflammation around the heart, the lung, you might have pain in your chest, pain around the lungs. People are even present with something like seizures or just a change in their behavior, like a total change in their mood or their behavior can actually be one of the ways that lupus can present itself. It involves the nervous system or the brain.
Well, but some of these, these are like, as you said, many faces, because this can be any and all of some of the other issues that may come up. So how does one drill down to say, well, this may be lupus? Is it a combination of the symptoms? Is it persistence of certain things? Because this could be arthritis. You feel like you're coming down with arthritis, or you're coming down with the flu or something.
Yes.
So
So
how
you're
does
quite
one?
right. You're quite right. You do need a combination of things that tell you that this is lupus. And what we say when physicians are making a diagnosis, first of all, they have to suspect it.
Right,
It may be joint pain, but it may be well. Once you have joint pain, especially in a young person, and especially a female, the idea should come up that it could be lupus. It may not be, but it could be. So you think about that. But you have to see a number of things coming together. Some of them may be clinically obvious, meaning that they have a rash, the hair is falling out, and they're having joint pain. So you see that kind of combination of things, and you say, this is very suspicious. This person very likely could have lupus, and you just need to do blood tests to confirm.
right.
Some people may present with one thing, or that may not be very specific. So then, if you suspect it, you have to dig down deeper and look for other parts, other evidence that the inflammation is occurring in other places.
Right.
And then you may have characteristic findings when you test to see if the immune system is switched on or turned on. You may find signs of this kind of inflammation when you do further blood tests. So you really have to be very focused on your blood tests. Sometimes your blood counts are low. Sometimes you can find certain antibodies, what we call autoantibodies, that suggest that the immune system is one of those sensitized immune systems. And then you may find various signs of inflammation on further testing. So you have to see a combination of things that tell you or help to confirm. Sometimes you can confirm very quickly. Sometimes you have to watch things as they evolve over time to really see what happens and to be able to confirm that this is really what it is.
Okay, thank you. So let us go over to Georgia now. So Georgia, first of all, tell us a little bit about yourself, and then tell us a little bit about your journey, how it started, what were your symptoms, why did you check for lupus? Did you check for lupus? Or let's tell us your story, but tell us a little bit about you. Who is Georgia Johnson?
Okay. Hi, good night. Can everyone hear me clearly?
I can hear you.
Okay,
I
great.
can hear
So
you,
I'm
Georgia.
Georgia Johnson. I am 26 years old. I just turned 26 last week, Wednesday. So I
Happy
am a
birthday, happy
baker.
belated. And if you're like me, the birthday is for the month. So happy belated.
Oh, yes,
Happy
yes.
birthday because it's still on.
Thank you so much. Okay, I'm a baker. I love arts. I love to bake. I love anything to do with the performing and visual arts. I kind of express myself through that, whether it's music, singing, or through baking. It's passion. My journey with lupus, I was diagnosed in 2017 at the age of 22. So this September will make it 4 years after the diagnosis, or that I've been living with lupus. The way I found out, I had some swollen lymph nodes on my neck. Usually towards the end of the year, I would get a cold, and it was just a regular thing to me. I was like, okay, it's coming to December. I'm going to get sick, and usually when I get a cold, the lymph nodes always get swollen. But I would always recover from the cold, and the lymph node would go back down. This particular time, it didn't. And I took a longer time to recover from the cold. The lymph node was still swollen. It got bigger and it started to become very painful. I still kind of put it off. I wasn't really thinking much of it. I was just like, okay, the cold finally went away, so the lymph node would have to go away sooner or later. So I wasn't really paying attention to it. But then I started getting excruciating migraines, and I was getting nauseated from the migraines. I would get some fevers. Very sensitive to light. Sometimes I couldn't even get to work. How bad the migraines were. I went to a couple doctors. The visits were kind of inconclusive. They didn't really see the need to do further testing. So I got a second opinion. She referred me to an ENT, a ear, neck, and throat specialist, and he said that he actually, when he examined my neck, he felt other swollen lymph nodes around the area. So he actually prompted me to do a CAT scan, and the scan showed multiple enlarged lymph nodes from my neck straight down to my pelvic area, because that's how far the scan went. So I did that test. He called me in and said that, you need to go and do a was it an antigen test, Dr. Tolerate? That's, I'm getting it correct?
Could be antibody, maybe antibodies.
Right, that
Antibody.
one. And it came back. Right, it came back positive. I also did a excisional biopsy of one of the lymph nodes in my neck. It showed tissue damage, so it was after then I was referred to Dr. DeCooler, who is my now rheumatologist, and he actually did the diagnosis of I have SLE. So that was how I found out. The journey has been, there's good days and bad days. I'm not going to lie. Um, Especially being diagnosed at a young age, at 22, you're kind of just like, is this, how is this going to affect my life? Because I was very active, I was going out with friends, and the more you kind of research about the disease, you kind of get a bit scared and a little bit intimidated about how it will affect body. And it did change my body. Being on the steroids and new medication, water retention, I gained a little bit of weight. The appetite wasn't really so great. And I didn't feel like how I used to feel. So after a while, getting used to it, and it's just something that you have to live with. I have a great support system. Friends and family, they understand that sometimes I'm not going to be able to go out or do the things that I can do, because I have to think about how it will make me feel afterwards, especially with going outside, the sunlight, or the fatigue that I'm going to feel after doing some things. And they're very supportive, they're very understanding. So that has been a major factor in my life in terms of dealing with the disease.
So, Georgia, you are a young lady and you are dating. How do you explain to a potential partner about this situation, and what has been your feedback?
My feedback from
Yes,
talking
let's say
about
for
it.
argument's sake, you're about to date someone. Do you tell him when
Right.
you're about to start the dating, or you wait until you get into it? Because I remember when I was diagnosed with breast cancer, when you remove the breast, and I was young myself, I was 35, and that was my biggest challenge. Like, at what point do you say to the person, this is my situation? What is your what how do you handle that?
Well, I think before I was more reluctant and hesitant to tell persons, because at the end of the day, I don't want it to be seen as so much of a weakness. It's just a disease that I have, that I'm living with and coping with. So at first I was reluctant and hesitant, but now I'm more open to talking about it. I've got lots of opportunities to discuss the topic and to bring more awareness to the disease. So right now I'm comfortable about talking about it and saying that yes, I have it, I'm living with it, I'm a face of it, and it's not going to define me. I'm still doing what I love to do. I just have to be more cautious of certain things that I put into my body or different activities to just help me move on day to day.
Did you change your diet, or how you operate in general in terms of exercise and anything like that?
Okay, so for exercising, I try to keep myself as active as possible, whether it's walking or doing some dance exercising, stuff like that. In terms of my diet, I did suffer quite a big flare at the beginning of the year, so that kind of altered my diet a bit. So no dairy, no eggs. I try my best to reduce the intake of red meat, my sugar intake as well, salt intake as well. No juice, no soda, just mainly water. And it has been good so far. At first, my doctor told me that, the diet is a big part of what will affect how you feel. And I was someone who loved cheese, I love fried foods, I love sugar. I mean, I'm a baker, I'm always eating sugar. So I'm like, I'm gonna have to give up all of these things. But the flare in January is a big wake up call as to, you need to cut back in your diet, and you don't have to give it all the way up. Sometimes you just have to
Mhm.
reduce your intake, or kind of
Everything
have
in
one
moderation.
cheat meal, a cheat day. Right? So it has been a journey, but I've learned a lot about myself and my strengths and what I can tolerate, and I can say I'm very proud of how far I've come since I've been
Awesome,
diagnosed.
awesome. Well, let me welcome Marsha and she's online and she's saying, big up yourself, lupus warrior. She's also a lupus warrior, and she also, as I said, I'm gonna send you her interview of last week. She has changed her diet. She has cut meat out completely. She does juicing. She does a lot of things. And she says she's here cheering you on. She's cheering you on from there. Now, remember, my friends,
Oh,
that the doctor is here. You can ask questions if there's anything that you don't know, you want to know. Please drop us a line in the chat. Ask questions. We're here to provide the information. That's why we're here. So back to you now, Doc. So, what is the treatment protocol for lupus?
So actually, there is no one treatment protocol, but there are some principles. Because obviously, as you heard Georgia's story, every story is different, and
Different.
so the specific treatment has to be tailored for the person and the
But first of
situation.
all, is there a cure for lupus?
We don't have necessarily the one thing that is a cure, so that will take it away one time and it will never come back ever. At least nothing that would we say is acceptable, because we've found that, for instance, certain extreme treatments have resulted in persons gaining remission, or their lupus. For instance, people have bone marrow transplants or something for some reason, and then the lupus, goes away too. So that's
Yes.
been known to happen. Cancer treatments and so on. But for the most part, the goal is to get the lupus into remission. And I know people think remission means that you don't have to take anything. But when we speak of remission, we're talking about all the signs and symptoms of the disease gone, so that the person is not feeling the symptoms, the blood tests, everything are normal. So that's the ideal place that you want to get to if you have lupus. And there are different routes to get there. And then having got that, you want to maintain. But you want to maintain that remission with medicines that are acceptable, that are well tolerated. And one of those things, we don't want people to be living on steroids forever. That's one of the things that people get worried, that they'll just be on steroids constantly. And certainly I don't do it that way. And I think most times rheumatologists nowadays, we always, there are so many different medications now that have come on stream, that there's usually a way to get the lupus into remission and to keep it there and to not have to take steroids. And we're not talking about the ones that make you run fast. We're talking about, when we say steroids, we're talking about these anti-inflammatory medications like prednisone. They work very quickly and they're very helpful, especially in an emergency. Somebody's really sick and you just need to get control of the condition. But over time, this is one of the big things that people with lupus complain about: putting on weight and their skin, kind of getting thin or getting stretch marks and having a round looking face and that sort of thing. And of course, we get concerned about the bones, and other things. So, and the eyes, the cataracts, and so on. So, we don't want people, we don't want people to just live on that. So, you actually have a lot of different medications, and that's sometimes the advantage of getting into specialist care early. That the right treatment regimen can be found and implemented, and you can be sort of guided through, in a way that will give you the best outcome. We want you to feel well. We want you to feel normal. That's what we
Right.
want. Sometimes it's a bit of a, and it depends on how you're affected, because some people, the lupus is easy to bring under control. You just need one or two things, and it settles down nicely. And some people have serious involvement, their kidneys, sometimes their blood cells, that sort of thing involved, and it's a little harder. To
Marjan is asking, she says she just learned today that the bladder can also be affected. She says, is that so? If yes, how?
Wouldn't say it's a common thing to come across, lupus affecting the bladder per se. What we find is that there can be a lot of comorbid conditions. Sometimes the same person who has lupus may have other things. So, say for instance, one common condition that contributes to a lot of the symptoms that persons attribute to their lupus is something that maybe your listeners haven't heard about: fibromyalgia. I'm just going to put that in the chat for the
Yes.
spelling. It is not, fibromyalgia is a condition where you have pain, and a lot of people with that also have fatigue, and it is not actually part of the lupus, but about a third of persons with lupus actually experience fibromyalgia. It's believed actually to be related to sleep, and sleep issues that may occur, and that is still being explored to understand what the connection is. But a lot of people with those conditions have a lot of what we call autonomic symptoms. So that could be irritable bladder symptoms, irritable bladder syndrome. You want to pee all the time, or you have to rush. Irritable bowel, the person who gets bloated, diarrhea, or constipated all the time, nervousness, palpitations, that sort of thing. What we call autonomic dysfunction. So it's one of those conditions that for some reason they frequently accompany or commonly occur in persons with lupus. And I hope I'm not confusing anybody, but it's one of these things where sometimes persons may confuse those kind of symptoms with the lupus itself. There is one other situation where the bladder could be involved, but it's much rarer. Some people who have very severe lupus have been exposed to very powerful medicine, intravenous treatment that actually inflames the bladder. And over time, the bladder may be irritated and even develop what we call, blood in the urine and other complications with the bladder, just because you took this medicine for a particular period of time. So, so that can be one instant, but I wouldn't say that the lupus itself tends to involve the bladder. But I know that a lot of people have certain accompanying complaints, and you can still that's frustrating, because lupus, the doctor might be telling you lupus is under control, and then you still feel tired and having all these things. So that has to be looked into. And in my experience, there is a big link up there with sleep, and sometimes there's a sleep issue that may need to be explored in a really direct, specific way.
Georgia, when you say you have a flare, what does that mean exactly? You mentioned having a flare.
I'm sorry, I didn't hear.
When you have a flare, when you have a flare,
okay.
Yes, when you have a flare, what does that entail?
A flare is when your symptoms kind of get the best of you. So they're more prominent. So for me, my joint pain was horrible. I had swelling. I couldn't really do what I love to do. I really had to just sit and rest, and I had to kind of regain my strength throughout the month of January into February by walking, so on and so forth. I got increased medication to kind of help counteract the flare. So really, after just when your symptoms get the best of you, it's just when your body is kind of just out of it for a while.
And it's
So
normally for a
I like
short
to
period
say
of
that
time.
when, well, it really depends on it. So I've had mini flares before, whether it's just the rash or just some joint pain that has gone like over maybe the course of a week. But this one, it started in December and I had it for 2 months, December and January.
Wow.
So
And when this
I
and
was
when this
off work
happens,
for a month.
oh, so you can't
Pardon?
work. You can't work, you can't exercise, you can't do anything when you have your flare.
Right. So that flare in particular was the worst one that I've gotten, and I couldn't work for a month. So I had to kind of focus on regaining my strength and getting my health under control first before going back to the daily activities and the routine and stuff like that.
And you do this through the medication and rest. When you say you have to get back your strength, what do you mean by that?
Right. So I got increased medication, but as well I cut back in my diet. So I was really watching. I was a little bit, to be honest, paranoid to eat certain things. So I was really focusing on what I was eating and trying to have an anti-inflammatory diet. So I wasn't having any red meat, no dairy, no eggs. I was focusing on a lot of wheat and grains and fiber, keeping myself hydrated as well, and taking vitamins.
You're breaking up. You're breaking up. You're breaking up and
Oh, I'm
freezing a
breaking up.
bit. Yeah, you're breaking up and freezing a bit.
What was the? Hey,
Yes,
are you
you're
hearing me
better
clearly
now.
now?
I'm hearing you clearly now. Yes.
What was the last thing you heard?
Um, when you were talking about your diet, you said something about your diet and cutting out
Right.
red
So
meat and
January,
yeah.
right. So I was trying to really focus on having an anti-inflammatory diet to
Hmm.
help kind of heal from the flare, because doing when you're actually like not doing anything, you kind of get more involved in the research and what is the flare and where it's coming from and how it probably could have happened, even though I know how it happened now. So with research, it was saying that I should try and incorporate anti-inflammatory diets, taking my vitamins, even trying to do some low impact exercising. So in the evenings, I would just go for a 10-minute walk to just get the joints moving, the blood circulating. So that's what I did.
When you were first told about lupus, did you know anything about lupus?
I did, because I do have another family member that suffers from the disease.
Hmm.
So I had a little bit of knowledge, but I wasn't really invested in it as I am now. So I've
Right,
learned more over the years, having the disease and living with it myself, and trying to get more persons a little bit more educated on the topic, and spreading more awareness is key right now.
right. You had it at a very early age, 22. Doc, is there an age group? Is it gender specific? Um, can we have some stats on, well, not necessarily stats, but
Yes.
what is your experience?
So Georgia's story is, what we call classic, because the average age of onset is 22. And
Okay,
so lupus is considered a disease of the young. 80% of people will be diagnosed sometime between 15 and 44. So most of the cases occur in that age group. And you have a few at the extremes, and including up to 20% of people are diagnosed during childhood, if you define childhood as 18 or less than 18. So it is a condition of the young, and it is a predominantly female, but not all female. So 9 to 1 female to male ratio. And if you look at
Wow.
the age where it comes on, this is where suspicion is that, there's a hormonal factor there that kind of may be a trigger. Um, so it can affect anybody, any age, any gender, any ethnicity, but we find some groups that are more at risk. And in our Afro-Caribbean populations, the rates of lupus are probably the highest, and it also presents itself as most severe forms.
Really?
So, yes. So lupus, an Afro-Caribbean population is considered one of the high-risk populations for lupus, probably for genetic reasons. I mean, yes. So we do see lupus clustering in families sometimes, as Georgia may have had a family member, although it is not considered an inherited condition. So having it doesn't mean that your child will have it. I mean, the odds of the child having it are, it's 98% likely that they will not.
Right.
So it's not inherited. But, like with every other chronic condition, that those genes, have a lot to do with what you're susceptible to. And so autoimmune conditions, and if it's not lupus, somebody in the family may have rheumatoid arthritis or thyroid disease or some other autoimmune condition. So sometimes we see those clustering in families.
When you say autoimmune, that everything affects your immune system. It means your immune system is not working, overacting. What exactly
Yes,
is that?
you use a good term. You said overacting. So people speculate as to whether there's some people who have immune systems that are more sensitive, and maybe in some other setting that was an advantage. We don't know.
Right.
But it can also mean that the immune system, like anything that is very sophisticated, which your immune system is extremely sophisticated. Some one little thing can go wrong, and then the whole thing is misfiring, and that's what basically happens. So, Georgia talked about when these lymph glands, were swollen, and of course we know that lymph glands are part of the immune system. They're where your white blood cells and so on get generated and made, and so on. So you can imagine when the immune system is reacting or overreacting, swelling of the lymph nodes is one of the symptoms that could occur. So that's why we use the term autoimmune, because normally your immune system is there to fight off threats. So everybody's talking about the immune system now because of COVID. So the immune system must recognize a threat, and then it can attack it. And that is, of course, why we get vaccinated, to help the immune system to recognize the threat early and attack it. And the way the immune system fights things off is with inflammation. So inflammation is actually a natural response of the body to a certain situation, and it's meant to be protective, but it is destroying or attacking the target, which is a bacteria or a virus or something. But what happens if those signals that trigger off the inflammation are wrong? Suppose you have the wrong signal, and the body is reacting to the wrong thing, including your normal, healthy parts of your body. So that's when we call an autoimmune condition. So, there are many, and most of them may affect just one part of the body. For instance, most thyroid conditions, there are different types, but most thyroid conditions are considered autoimmune. Then you have even some types of diabetes, autoimmune, rheumatoid arthritis, autoimmune. So there are many things that are autoimmune, but they may only focus on one part of the body, like the thyroid or the joints or the pancreas. But in lupus, you can have all these various parts being involved, and that's what makes it difficult. And it's going to be different for different people. Some people have a mild situation. Some people have severe, and severe is when we think a critical organ is involved in a way that it could threaten either your life or and that can happen. But thankfully it's not to everybody and not all the time. So a person may have a journey, and it's really tough. As Georgia said, most conditions that we call chronic, in the term, we use the term chronic, people have
Right.
all kinds of ideas of what that means. All it means is that it is ongoing, right? It's not a cold or something. It's something that you live with. And most conditions that you have to live with, like hypertension, high blood pressure, diabetes, cholesterol, and all these things, people tend to get when they're older, and their friends are have these things, and they're all taking tablets, right?
Right.
But when you're 22 and you get told that you have something for lifelong, and also because very often when it affects the young, sometimes it can be actually, a lot of people who got severe involvement are the young, young people with the kidneys involved, and they're having to take a big pile of medications, every
Mhm.
day. It's tough. So, that's why we have these organizations like Lupus Foundation.
Right.
Roger is one of our volunteers at Lupus Foundation, and
Yes.
it's really about supporting people through that journey,
Mhm.
empowering people with with the support they need and the tools they need, the knowledge they need to really negotiate this journey and not be alone. It's really
How,
important
how,
that we're not
how
alone.
do we measure up in Jamaica in terms of awareness? How do we measure up in terms of awareness of lupus? How, are we aware of it, or it really is one of those creepers?
I think that it is growing. We have not done a study, and I think maybe that's something that we should do to test
Mhm.
people. But we recently had a little function for World Lupus Day, and we did a little vox pop on the street. And it was noticed that a lot of people were actually aware of lupus. At least they
Okay.
had heard about it, may not exactly know what it is. But I believe that in Jamaica, most people know somebody with lupus. They may not
Right.
realize that they have lupus, but based on the frequency with which it occurs, most people probably know somebody with lupus. And I think
Yes.
more people are being open and expressing themselves. For instance, during World Lupus Day, we call it Make Lupus Visible. That was the theme
Yes.
all around the world. Make Lupus Visible. And in Jamaica, at least with the Lupus Foundation, the members, we just made a call out to say, you want to send your photo for a collage, and in a day, 40, 50 photos, and people were just out there saying, let's make lupus visible. Let's remove the mask.
Awesome.
We
Yeah,
had a
that's
program
that's
talking
how
about
we do.
removing the mask, yeah,
Yes,
unmasking the many
absolutely.
faces of lupus.
Absolutely. Marshawn was saying that earlier, to get the information out and to share your information is really very critical. Shireen is asking, is there a way to screen for this disease? Who usually gets lupus? Is it random? I think we had answered that earlier. Shireen, if I'm not mistaken. I think we had asked that question earlier.
It's it's
Um,
a it's a good question. I see where
yes,
she's going in the sense that sometimes people want to know if there's a way to find out before they
beforehand.
get the symptoms.
Yes.
In
Like with
general,
like cancer, you have like the BRCA gene or whatever, like breast cancer or whatever. You can find out. Is there anything like that for lupus?
we don't really have a way to screen for lupus because if you try, you may be wrong most of the time. So, for instance, a lot of the consultations I may get is because people are for people who have an antibody. So, some people who have this autoimmune process going on may actually develop antibodies that we call autoantibodies. So we know that they're not against COVID or flu or mumps, but it's against a normal body tissue. So that can
Mm-hmm.
be a marker of a tendency to autoimmunity, but it doesn't tell you that you have a disease. And so a
Mm-hmm.
lot of people, somebody with a thyroid problem or somebody with rheumatoid or some other thing may have the same antibody, or somebody who may not have anything at all, nothing is wrong with them, 5% of the population, and have an antibody. So if you go around trying to test for it when nothing is wrong, you're going to be wrong most of the time, and you're going to put yourself through undue stress. So something needs to be wrong clinically for us to say that it's a disease. If you don't
Okay.
feel sick or something is not wrong with, like, for instance, somebody may do a blood count and they say, wow, your blood count is so low. Why is it so low? And it could be one of the common things, but it may turn out that it's lupus. But that is one of the rare conditions where you may just show up with something. But there again, still something is wrong. And that's a normal test to do. To check your blood count is like a normal thing that somebody will do
Right.
once a
Yeah,
year or something. So we don't
exactly.
go looking and saying, because my sister has it, or because my mother has it, or my friend, that you're going to run all kind of tests and so on if you're not sick. So if you don't have one of those signs or symptoms, just don't worry, right? But if something is wrong, it should be explored. And it's good to know that some of the most common signs or symptoms, not necessarily to diagnose yourself, but to say, let me think about it. Could I have lupus? And let me think about it, or the doctor should say, let me think about it.
Is it one of these diseases, if once you catch it early and do what you need to do, based on what you have been told by the doctor or whatever, you can manage it better than if it just goes on and then you catch it later, later rather than sooner, is it
Definitely.
one of those disease?
It's always good to catch things early, because, as we know, it's not, sometimes people think that, as we said earlier on, lupus is not cancer. It's not something that just starts off one way and just spreads and then until the inevitable. No, it's not
Right.
like that. Okay. So, but we know that when there are flare ups, each time there may be a flare up, then depending on where it affects, some part of your body could be damaged. Okay, so
Okay.
we don't like people
Thank
getting a
you.
lot of flare ups, and we don't want things to, as a major organ. So, say for instance,
So part of the treatment is to minimize like flare-ups.
yes, yes. So
That's
that's
good.
why we say
Thank
bring
you.
it into remission early and then keep it there. And that requires monitoring, and it usually requires medications that control the condition. So you monitor closely, and sometimes a blood test, you can do it and you can pick up a flare up even before you feel it, right? Something like checking your urine for protein. You might pick up something that, okay, there is, the kidneys are a little bit stressed.
Yes.
So you don't want things to get to a point where you're damaged. A lot of people have, Selena Gomez, for instance. I mean, a lot of people know her. She has lupus and her kidneys were destroyed. So she had to go out and get a transplant. Okay. And that is
Wow.
a function of, not everybody has kidney involvement, but a lot of people do. Some forms are
Mhm.
mild, but some are very aggressive. And so if you miss that, or you take too long to deal with that, then you end up with damage. Because you can think about, for instance, like, you think about a fire, for instance, we talk about inflammation, and that's where the word comes from. But if you think about a fire, if you just have a small little fire that you can out with um, your little cup of water or something,
Yes.
that's fine. But if it's on the walls and on the, you
You
really
need
have
an
to get the fire
extinguisher.
department. Yes.
Mhm.
And because the longer you take to deal with that, and that's like a flare. If you have a major flare, it can cause major damage. So you don't want it to get
Marsha
out
Ann
of
says,
control.
Marsha Ann says she describes her flares best as a sugarcane field on fire.
Yeah, some people can get bad, flares,
Mhm.
So it all depends. Each person is different, but monitoring is really important. When you talk about flares, people can often figure out the triggers. I would say, honestly, I mean, people might say it's doctor talk. One of the most common reasons for flares, actually, persons coming off their meds. It may be a doctor doing it, like the doctor may be reducing one of your meds because you're doing better, but then he's supposed to monitor. Okay, but sometimes you may just feel good and say, what am I taking all these pills for? I haven't had symptoms in a long time. Stop. And you're okay for a week or two. And then suddenly, things are building up while you're off, and feel okay. and then suddenly a flare. So that's one of the common reasons, and we understand the frustration, but we ask the patients really just try to stick with us. It takes a lot of patience. It's hard. It's a lot of pills, but some things have to be done gradually and in a particular way. And if a medicine is affecting you in a particular way, you have to negotiate. You have to speak up. We're working on a health journal. I'm not putting ours in trouble, but we really want
Yes.
to have a special journal for lupus patients that helps them to keep track of things, know what to say, keep their notes when they come to the doctor so that they can express themselves. You might forget about the symptom you had last week. So it's very important to have an open relationship with your doctor. Luckily, there's more than one rheumatologist around. So if Tolerine is miserable, you can go to another one, right?
Which she's not.
Some of my patients.
Do we have many rheumatologists in Jamaica? Because I mean,
Yes,
I only recently knew of a rheumatologist when I had to see you.
Well, Dr. DeCoola held the fort for a long time on his own. And then, a few of us have been coming in from time to time. And now we have 5 rheumatologists. And we have also in the government sector, like for instance, I work in government, I work at KPH, and you have a rheumatologist at Cornwall Regional, she's Dr. McGee, and you have one at even Spanish Town Hospital, which a lot of people haven't realized yet. So you're actually on the university. So even if you don't have money, you can have.
I was coming to that to ask you how expensive it is to manage this disease.
It's going to vary a lot, but some of the medications can be very costly. Very costly.
Is it on the NHF?
Yes, and that is one of the things that we're really happy about, working with NHF, as a Lupus Foundation, that they were willing, and that the government was willing to really create these subsidies for lupus patients. That was 2019. So for those who haven't realized, if you can go and get your card updated, because you have subsidies. Some of the very expensive drugs have a subsidy now on the Lupus Foundation. And they may still be expensive even after you've taken off a third of the price or a half. It may still be a lot. We know some medications that will run you over $100,000 for one per month, right? And you may be on more than one, yes. So fortunately, a lot of those same drugs are available in the government system. And so a lot of, like this week, I'm holding the helpline. We have a helpline. People text us and call us. So pardon me if you don't get answered right away. We volunteer, we rotate it. But a lot of calls are, about costs. And sometimes we're able to help people find a treatment center in their area, find a rheumatologist, depending on their situation, their budget, and so on. We're here to help you. And we have a lot of our volunteers, our health professionals, all the doctors, all the rheumatologists volunteer with Foundation, and you have kidney doctors, you have physios, you have pharmacists, we have social workers that all volunteer with the Foundation, and we're here to get together, solve problems, respond especially to our members because we're a member-based organization, so we're encouraging to join. So that they can be part of it and have access to the information, be in the support groups, get the newsletter every month, know what's going on, be on that WhatsApp group, and so on, participate and even volunteer, a lot of people tend to volunteer a lot.
Georgia, how has the foundation, well, you work with the foundation now and you have been experiencing the foundation, and as well, before I forget, how are you managing in terms of the expense for your medication? Is that a challenge for you as well? So I want to hear about your experience with the foundation and also in terms of managing your disease with how challenging is it to manage your medication in terms of cost and availability. Because sometimes even if we can afford certain things, to get it is a challenge.
Right. I joined in January, I believe, the end of January. For the main reason of just seeking support. I don't have any friends around my age group that has the disease, so I felt like I was a bit alone going through it. So it was actually my mom that reached out first, and they said, tell her to join the foundation. It will be good for her, so on and so forth. I then met Dr. Toleride, who after I submitted my story to the newsletter, she said that she wanted to talk some more with me. And then that's when I kind of got, the prompt to join as a volunteer, to volunteer my time to the foundation. And it has been an amazing experience thus far. Feel a part of a group and a community that, there's persons going through the same thing that you're going through. It's very liberating and it's very inspiring to hear other person's stories, how they've gone through what they've gone through. Some have been hospitalized, gone through surgery, lost their hair, even some persons have lost loved ones to the disease. So it has been, yes, a very excellent experience working with the foundation. And I do urge persons out there, if you have a family member or a close friend or a loved one that has a disease, or even you can come and, learn more about the disease and volunteer your time to our station, because we do need help. We do need a lot of help because, as Dr. Toleride said, it's a member foundation. So even out of the members there have the disease, and the times, we may not be able to carry out some of the things that we want to do, the responsibilities that we want to do. So help is needed always. So, you could always look on our website or on our Instagram page, our social media pages, Facebook, to get more information on how you can join the foundation and volunteer your time to make lupus more visible and spread awareness about the disease.
Are the drugs readily available to you and
Pardon?
affordable? Are the drugs readily available to you, and what about the affordability? The drugs that you need.
Sorry, I'm not hearing at all. I'm so
Okay.
sorry.
Are the
Drugs?
drugs readily available to you when you need them? And what about the cost of the
Oh,
drugs?
yes. Drugs have been readily available to me at the moment. Um, Last year, when the pandemic started, there was a little bit of shortage for HCQS. I was having issues finding that drug. A lot of pharmacies didn't have it. I had to travel all the way to Kingston to get that drug. But now, my medication is readily available for me. A family member that has the disease as well, her drugs are readily available for her as well. The National Health Fund card has helped a lot with the cost of the drugs. So I applaud the government for taking that initiative and that action to add lupus to the disease that they cover or support. But it it's going to cost in terms of the doctor's visit, the medication, the blood test that you have to carry out maybe every 3 to 4 months. It does add up, but we're getting through it. So yes.
Okay, so I want to show a little video that Doc sent to me. That was, I'm glad to see that you can even try to show a light side, to Lupus, one of the members of your group. Did
This
a
is
TikTok.
George's team member.
Okay, let's check in on the lupus symptoms and see what kind of day we're gonna have. Let's start with you, fatigue. Yeah, it's looking like a moderately good
Sorry,
day
hello?
with a chance of a nap in the afternoon. Okay, and how about joint pain? Oh yes, we will start our day very slowly, and then tonight you're going to have a very sore knee. Flare? Medication? Oh yes, today you will take a tablet and don't forget your folic acid.
Oh yeah, and don't forget about me, eh?
A headache? Why? Alright, let's check in on the lupus.
So
That's
I
scary.
just
That's
feel
scary.
like, even although it's rough, it's a nice way to let people understand what persons with lupus have to go through. I mean, it's funny, but it's a lighter way to get to persons to say, okay, this is what we go through. And I see where there's an ability also to donate. Let me also give the information on. Because, as you said, the foundation needs funding in order to do all the work that they set out to do. And what is some of the work that the foundation sets out to do?
Well, across the board, we're all about improving the lives and the outcomes of people who are affected by lupus, and that includes information, support, advocacy, and even research. So it's really across the board. When it comes to lupus, knowledge is power.
Right.
And this applies to persons living with the disease, and it also applies to everyone. So a lot of what we do, public awareness campaigns, like World Lupus Day, we just had intense, and we're on the media. We do a lot of social media. So Georgia and Sherry, who you just saw, are part of our volunteers for the social media team. They work a lot to just get the word out. Lupus Awareness Month we hold in October, and then we're out in the community, especially before COVID. But now we've got online. So information about lupus, literature, getting those out to the clinics, that kind of thing, maintain the website. People can jump on our website at any time, find out what's going on, see the news, what's going on, and so on. So get information about lupus. And we also, people need a lot of support. So for instance, for members, a number of things we do, members have access to, of course, regular support group meetings. And we have more than one support group. They're online. You have access to health professionals. You have a member card, which gives you discounts at certain pharmacies. So a lot of pharmacies or businesses may participate in that program. We have free counseling. We have a member medical assistance committee that can help you if you're running into difficulty, and find the resources that you need to. So it's really across the board advocacy. I mean, equipment, donating critical equipment, getting the word out. Working with NHF and other groups, just to make sure that people have a voice, and that what we're learning about the lupus is relevant to our setting. We talked about patient-centered research, even education for health professionals. We have training for health professionals every year in our lupus symposium. And this is really important. A range of doctors are involved in the care of lupus and must recognize it and know the cutting edge. So we bring the cutting edge of experts.
Awesome.
To the base. So it's all about, it's a lot of work, but it's really, we really see the impact, and it makes a difference. And as you know, we need volunteers, we need donations. It makes a difference. Or a lot of our volunteers have lupus and can't, just want to wave to Anne-Marie and Miss Allen, who volunteered today at the center.
Yes.
And are helping us prepare for our audit. those accountants that came by, not even members, on the weekend. Thank you, Khadija, and who came to help us prepare our paperwork. So there's a lot that's going on, and we need all the support we can get. So find us on our website, lupusfoundationjamaica.org. Follow us on our social media, whether Facebook, Instagram, TikTok, as you can see, that's early. and
Yes.
LinkedIn and so on. So you can find us easily, I think, on a Google search, and give us a call on our helpline. The helpline number is, let me just find it. It is, yes, 876. Let me just scroll down and get my WhatsApp. I should know it by heart. Here we go. Good. It is trying to view it and it is frozen. I have to use my phone. Georgia, you remember it offhand? Okay. Oh. All right. So good. It is 876-778-3892. It was on the graphic you showed earlier, but
Yes.
778-3892. So you can WhatsApp us there. If you
And
don't
I
answer, we'll call you back.
on the page.
That's our WhatsApp. There's a
Yes.
landline for the office, but it's not always monitored. But we keep an eye out.
Right. Well, Georgia, as we wrap, is there anything that you'd like to share with our listeners, our viewers? Anything that we didn't get from you, or I didn't ask, that you'd like to share about your journey, or anything about lupus, or anything about the foundation? Is there anything that you'd like to share at this time as we wrap? You hearing me, Georgia?
I think sound. Yeah, she's not hearing.
Not hearing me? Georgia, you hearing me? No.
All
Not
right.
hearing me?
Let's see if we can hear
Come
her.
out. Come out and come back in. Come out and come back in. Yes. And anything, Doc, from you as we wrap? Is there anything that I didn't get out? Anything that you would like to say about lupus that I didn't cover? Because, as I said, this will be posted on YouTube and Facebook, and so that it's there permanently for them to get this information at all times.
That's wonderful. I think you were excellent. I think you pulled out all the essential questions, and your listeners, in their comments, they asked some great questions too. So I would just want to encourage us that, lupus is everybody's business. It's not just about one person. As you can see, this is a condition that strikes at the peak, very often at the peak of your productive lives. When you're studying, you're starting your career, you have a young family. And so the impact goes beyond the individual, to families,
So
the
would you say
workplace,
stress?
the
Would you say that
community.
stress plays a heavy part?
Yeah, it can be, persons living with lupus face many things, debilitating symptoms sometimes, cost of medications, the burden of living with a chronic condition. But it's also stressful when the persons around you don't understand the condition. So when there's stigma, or there's just a lack of knowledge, lack of understanding, this adds to the stress of living with the condition. And so it's really important that we all make it our business to know about lupus. You may even be the person who saves a life. You might be a teacher, a co-worker. We talk about our campus awareness program because of the age group. So you may be the person who says, this could be, maybe you should get checked, right? Or the person who can give that support. You need a support system around you. Who's the person that's going to take you to the doctor when you feel sick? Who's the person you can call to run an errand for you, pick up your prescription for you? So and it's really important to have a support community. We try to do that here at Lupus Foundation. And, I think that's happening. So, but it's really important for us all to get involved. And, that's my message.
With your message about medication, do you have a section that deals with healthy lifestyle and what to eat, what not to eat? Because maybe there are things that we are not to eat as well. But most importantly, what to eat. Do you also focus on nutrition?
Yes, that's probably one of the number one questions that we get from people with lupus, because people want to feel empowered and to feel in control of what is happening. And we know that's important to really support your body, even if you're having treatment with medication. It's really important to support your body in a way that allows it to function better and to heal better. And so, your lifestyle plays a big role in that. Just all the things that Georgia described are really relevant. We also know, which a lot of people don't realize, is that persons with lupus are at high risk of what we call cardiovascular disease. So people may talk about cardiovascular disease, risk of heart attack, stroke, and so on. This will occur a lot earlier and at a lot higher rate than in a person with lupus than the regular person. It has to do with the presence of inflammation. So a heart healthy diet, a diet that is high in fruits and vegetables, very nutrient rich, right? And avoid things that are difficult for the body to process, avoid things that will cause weight gain, exercising, making sure you have adequate sleep. And as we know, that may be a simple matter of developing the right habits, but sometimes you have to explore further, as you were saying, to know if you have a sleep problem.
Right.
But these are
Actually, that's
all
how I
things that
came
are
to you.
important.
I came to you because I was having joint pains. And then when I came to you and you did all your tests, you eliminated that I had rheumatoid arthritis. And then you suggested that I visit a doctor that dealt with sleep apnea. And when I went, that actually was my issue. I now sleep with a CPAP machine. The joint pains were reduced. I was sleeping better. My blood pressure that was constantly climbing went down. I lost weight. And so these are some of the things that we really don't know in a doc until
Yes.
you really investigate and find out. And as of course, if you don't have the money, that is a challenge. Because if you don't have the money to go to the various different doctors, it
Yeah.
is a challenge. But to know, if you are aware, you can probably just can go straight to where you really need to go,
Yes.
and eliminate,
Yes.
right?
So our
So
bodies
Georgia,
are so
you're back?
complex. Here's
Oh
Georgia.
yes. So Georgia, you're back. You hearing me now?
Yes, I'm hearing you a little better.
Great.
Still a
So
little
I
shaky,
was
but it's much
asking,
better.
yes, so I was asking in wrapping,
Pardon?
is there anything that I didn't cover or you didn't get a chance to say that you'd like to say at this time as we wrap?
Just to tell anybody that is living with the disease, don't be too hard on yourself. Celebrate the good days, but when you have bad days, don't be too hard on yourself. Don't let this disease define you. You can still do what you love to do. Do what makes you happy, and yeah, a support system is key. And volunteer at the Lupus Foundation of Jamaica.
Enjoy, and I shall run the information again to tell persons how to donate and how they can
Contact.
play a part and how they can contact the Lupus Foundation. Dr. Desiree Toller-Reed, 1,020,000 thanks. I mean, the information was awesome. I know you're very busy, and I so appreciate you joining us and sharing. You clearly are doing a lot of work. As Marsha Ann said, you're also clearly passionate about assisting persons with lupus, and we really appreciate you for that. Georgia, at a moment's notice, you're not even home yet. I'm thanking you so much, Dr. Dr. Tollery got hold of you in a minute, and you were more than willing to come and join us. I really appreciate it. I just want to tell my guests my audience how special they are, because we have a warrior who wants to share her information, and I'm sure there are people out there that you have helped tonight. I have no doubt Because every night we go on, every Monday night that we go on, there's always somebody to say, boy, I didn't really know about this, or I've never heard about this before. So we are learning, and with knowledge comes power. So I just want to say thanks, and Doc, I promise you I will post the information that you sent to me, and hopefully you'll get some more hands on deck at the foundation. I'm already swamped. I can't even come. But I'm so swamped with breast cancer and all the other areas.
This is enough.
Yes.
You provide a
But
platform.
I know there are persons out there, and I'm calling on anyone and I'm pointing a finger. But I know there are persons out there who in time, they will join and they will assist. And I thank you once again. Have a good evening. Have a wonderful week. God bless. Thank you so much for joining me tonight. Folks out there, thank you so much. Only Marsha and really commented well on I'm seeing tonight. But I know you're listening because I see persons online. But this will be uploaded for you to get your information. You can rewatch at any time at your leisure. Thank you so much for spending the hour and 15 minutes with us. We really do appreciate it. You are one of the reasons why Boss Lady Live is still around. And so we have 2 more shows before the end of July, and then we go on a break for August, and then we come back with a bang in September with more information. So join us next week. We're not sure who yet, but I'm sure it will be another riveting, interesting, informative show. So see you next week, same place, same time at 8 p.m. sharp, online, YouTube, and Facebook. Thank you. Have a blessed week. Thank you, Doc. Thank you, Georgia.
Thank you.
See you soon.
Thanks for having me.
You are very welcome. You're very welcome, my darling.